This initiative is really interesting in a sense that we want to focus on concrete objectives. So we all agreed that we have to turn declaration into actions, and we said, well, let's be concrete. What can we do at the European level to really tackle AMR? For example, there are some good examples in Spain, for example, of real-time surveillance. Well, this example in Spain can be spread at the European context, so we can use it to increase the monitoring and surveillance at the European level and inform decision makers about the consumption. We had also discussion about communication campaign. Communication campaign is different from one country to another, but still, one communication campaign has had some good impact on the population in one country. Maybe it could be useful to use it in another country. We also said there is something to do on infectious control program. So basically we will test and see the common points between different countries, because the situation is different from northern countries to southern countries, and see what are the key elements there. And we want to capitalize on existing initiatives from ECDC, WHO Europe and so on, to really move forward according to good and evidence practice. It was really important from the very beginning to be as inclusive as possible. We have 28 countries and 44 partners involved, and this is the result of our willingness to really be as wide as possible. We consider that AMR cannot be tackled only by policymakers. We have to involve industry, we have to involve patients, we have to involve organizations, we have to involve health professionals, scientific societies, hospitals managers. We have to be as inclusive as possible. Each one is responsible for tackling AMR at its level. The biggest challenge for the joint action is to ensure that all the many initiatives that exist across the world are able to work in the same direction. Because what we have analyzed in 2015, 2016 is that there are numerous initiatives over the globe that exist, but they are not interconnected with one another. And through the joint action, we will really foster the synergies of the different actors to work on concrete actions. This is a first step. We will not be able to address all the issues within the joint action, but it's a first start, and then we will continue to work to achieve concrete results.